trial was a randomized phase 2 trial where patients with asymptomatic, untreated melanoma brain metastases, which were active because they were untreated, were randomized to either nivolumab combined with ipilimumab or nivolumab alone. Now, the rationale for that trial was that patients with melanoma brain metastases are very difficult to treat. It carries a very poor prognosis. About 20 to 25% of patients when first diagnosed with advanced melanoma have brain metastases, and they're largely excluded from clinical trials. The three cohorts were the two I just described. So cohort A, where patients were randomized to ipilimumab combined with nivolumab, and they had untreated asymptomatic brain metastases. The second arm, which was cohort B, patients were randomized to that, 1-to-1 between A and B, and that was nivolumab monotherapy for asymptomatic untreated brain metastases. And then there was a cohort C of only 16 patients, and they were basically patients who had a lot of symptoms or leptomeningeal melanoma or previously treated brain metastases with local treatment that had progressed. So they're a separate cohort. There was not a lot of activity of nivolumab monotherapy in that arm. So I'm just going to focus on the randomized cohorts A and B. So nivolumab versus nivolumab combined with ipilimumab for patients with untreated asymptomatic brain metastases. There were 35 in the combination arm and 25 patients in the monotherapy arm. The reason for that was that we randomized up to 51 patients. The plan was to randomize to 60, but at 51 patients, the combination of nivolumab and ipilimumab became widely available within Australia. This trial was conducted across Australia, and so therefore the remaining 9 patients were enrolled in cohort A.